Let me introduce you to more of the gut terms that we're all hearing about on social media, yet very few of us actually know what the heck that they mean. So welcome to another episode of Learn with Lo. We're going to be continuing our series on these debunking of some of these very common gut terms that are becoming more mainstream, especially on our social media platforms. And you're definitely hearing about them if you're venturing into more of the conventional gastroenterology or even functional gastroenterology spaces for all of my fellow gut health warriors out there. So if you missed part one of this series, a couple weeks ago, we talked all things with this term leaky gut. No doubt if you've been into the functional health space at all, you've probably come across the term leaky gut. And again, a lot of individuals even come to my practice and come to my clinic suspecting that they are struggling with leaky gut because of some of the common symptoms associated with that, whether it's a lot of bloating, food sensitivity, autoimmune disease and autoimmune patterns, but so few people are actually treating leaky gut the correct way, in my professional opinion. And conventional gastroenterology just dismisses the term altogether, which is incredibly unhelpful. And then functional gastroenterology or functional medicine is trying to treat leaky gut before they're actually treating the source of what is making the gut leaky in the first place. And so we're just spinning our wheels, we're wasting our time, we're wasting our investment if we're going to try to skip steps there and not truly understand why that's a thing to begin with. And so one of the other common terms that I have seen more and more frequently on social media and building this series is a term called SIBO. And that's what I want to talk about today. SIBO stands for small intestinal bacterial overgrowth. So it's an acronym. And SIBO is very commonly thrown around again in more of like the functional health space. And SIBO as a medical condition is very real. Even your conventional gastroenterology recognizes SIBO. They test for SIBO, they treat for SIBO, and it is one of those things that has a very, very high relapse rate. Over 50% of individuals that are treated for SIBO end up being treated multiple times with zero success. Why? Why is that? Well, I'm going to talk about it today, but let's just suffice it to say that SIBO is not a root cause picture. And if we're not understanding how to treat the root cause of SIBO or a more comprehensive treatment plan of SIBO, individuals stay very, very stuck. And if you're treating it from a conventional gastroenterology perspective and they put you on antibiotics for SIBO, if you've ever had antibiotics for SIBO, you know that those are not cheap to fill at the pharmacy counter, and then for them to not work and you have to repeat the treatment about every 3 to 6 months. Not something that's a very wise investment, is it? Because it really leaves a lot of individuals stuck. So today, what we're going to be talking about is this term called SIBO, and very commonly in a lot of spaces, the symptoms of SIBO are going to overlap a lot with your classic irritable bowel syndrome or IBS. And so we're, like I said, going to be venturing into this space of really understanding what truly is SIBO. Why does SIBO have such a high relapse rate and such a high unsuccessful treatment rate? And also, how are we going to be thinking about this so much more inclusively and differently in my practice and my holistic medicine methods to be able to give people a much better experience for this particular condition. So without further ado, let's dive in a little bit more. You know me, I love the science. I'm going to really be talking about what is SIBO first and foremost, because once we understand that, we're going to be the light bulbs of why our treatment, our current understanding and our current treatment of SIBO is falling short. It'll just be this huge aha moment. You're like, well, duh, yeah, that makes sense when you start to understand what exactly SIBO is. So before we talk about anything of protocols or anything like that, let's just understand the pattern of SIBO. SIBO, again, stands for small intestinal bacterial overgrowth. So this pattern of bacteria in the gut is truly just a picture of bacteria where it shouldn't be. If you know anything about the small intestine is a relatively sterile environment. There shouldn't be a ton of bacteria in the small intestine. Most of this should be in the large intestine. So if there's bacteria in the small intestine, the first question you should ask is, why did it get there? How did it get there? Why do we have bacteria in the small intestine? I'm glad you're asking that question because that's the same exact question that I asked too. A lot of times the small intestinal bacterial overgrowth picture, it is a translocation problem, meaning that this bacteria should be somewhere else and somehow it has found its way into the small intestine. And so if we treat it as a bacteria in the wrong place kind of picture, then we're going to get a much better holistic treatment versus how conventional gastroenterology or honestly even functional medicine treats it, is they just treat it as something to kill. Right? They're like, ooh, bacteria's in the wrong place. We're just going to kill it and move on. Well, guess what? It's going to come right back because we didn't ask the question of why did it translocate to the small intestine to begin with. Where there is bacteria, there is a process called fermentation. This is going to take you a little bit back to some of your biochemistry days, but we're going to keep it super, super simple because all of you have witnessed fermentation already. If you have ever made any sort of bread, if you've ever made a yeast product, you know that putting yeast, adding sugar, adding water, what starts to happen? You start to see the yeast come alive. It starts to bubble, right? And it bubbles and it starts to foam and it starts to grow because that yeast is fermenting the sugar that is found in that medium and creating and letting off gas. Okay, that is fermentation at its finest. And when there's bacteria or there's yeast and we ingest carbohydrates, that is going to cause fermentation. Fermentation causes gas. Gas that is trapped inside the small intestine doesn't feel great. So as you can imagine, some of the common symptoms of SIBO are going to be abdominal bloating. Bloating is a big one. Individuals that are like, I wake up bloated, I'm bloated all day long, I go to bed bloated, it doesn't matter what I eat, when I eat, or what I don't eat, I feel bloated. So abdominal bloating is a big one. Visible distension, like you see the lower belly rounding, and it's not just feeling full, but like visible abdominal distension. A lot of excess gas, either gas from like a flatulence gas or gas from a burping or a belching perspective. Sometimes then we also get a lot of alternating patterns of constipation and diarrhea. Some people are like chronically constipated, in which case they have more of a methane dominant SIBO. And then you have some individuals that have more of a diarrhea dominant SIBO, and that is usually more of a hydrogen sulfide SIBO picture, right? So there's different gases, different bacteria, different fermentation processes that are happening here, but all are leading to the same uncomfortable symptoms. We have bloating, we have visible distension, we have gas, we have alternating patterns of constipation and diarrhea. A lot of times these individuals also experience brain fog. They also experience fatigue. They have a lot of food sensitivities that they're trying to tie these symptoms to. A lot of these individuals with chronic SIBO also have a lot of malabsorption issues because we're supposed to absorb our nutrients in the small intestine, but if there's so much inflammation and fermentation happening there, these individuals get some very significant nutrient deficiencies. Chronically low iron, chronically low B vitamins, chronically low zinc. They end up with a lot of significant nutrient deficiencies. So understand that these symptoms of SIBO, once you start to understand the picture, you're like, well, yeah, there's bacteria where there shouldn't be. And then the food that we're eating is getting fermented by that bacteria and creating excessive amounts of gas. Yeah, the symptoms are not random. It makes total sense because the symptoms are going to be the byproduct of the fermentation because the food is not being properly digested and absorbed. There's too much bacteria where there should not be bacteria in this situation. So to understand SIBO, though, we have to ask that question of why. Why is there bacteria in the small intestine to begin with? Because this fermentation process is supposed to happen in your colon. It's supposed to happen in the large intestine. And when it happens in the large intestine is much more equipped to handle fermentation than the small intestine is. The small intestine is literally one cell layer thick. It is super, super thin, right? Whereas the colon has much more significant cell walls. So the small intestine is one cell layer thick. And guess what is also housed in the small intestine? Your immune system. 70% of your immune system is found in the small intestine. So if we have an overabundance of bacteria that is right there in the small intestine, right next to the immune system, you're going to have a lot of systemic issues. So yes, SIBO is something that it is uncomfortable. It is a lot of gut issues. It is a lot of food sensitivities. But I think the bigger picture of why I'm really passionate about this SIBO picture is we can't just treat it as something to kill, because these individuals usually have a high relapse rate of SIBO, and a high relapse rate of SIBO is contributory to autoimmune disease. That's a big picture, okay? Because we have an epidemic of autoimmune concerns, and people are just getting put on steroid medication and biologic medication when this is a deeper gut issue going on. And so this is, like I said, also a little bit of a tie to how I feel like our modern medicine's dealings with autoimmune disease are also all wrong, but I'll leave that as a conversation for another time and just focus on SIBO today, right? So you can see where conventional treatment is going to fall really short is if you have any of these uncomfortable symptoms, usually the first place you go to is your primary care provider, which is great. And then they're probably going to have kind of an immediate referral to a gastroenterologist. And I'm going to go and venture as a guess that your experience is going to feel something like this. You're going to go into the gastroenterologist with all these uncomfortable symptoms. They're probably going to order something called a breath test for you. And this breath test is going to be something you can do at home, but you're going to drink a high sugar solution and you're going to breathe into a sample bag at intervals over the next 4 hours. And based off of the gas that is trapped from that breath test, they're going to test you for positive or negative for SIBO. That's just how conventional gastroenterology is going to test for this. It may come back positive. If it comes back positive for SIBO, you're going to walk away with antibiotics. Like I said, the rifaximins of the world, the expensive antibiotics that are just focused on like killing the bacteria, but no question and no thought process of why that bacteria is there to begin with. So if it's positive, you're at least going to get some antibiotic treatment. If it's negative, they're probably going to send you home with a handout for a low FODMAP diet, right? Essentially a low fiber diet. Because if I can take the fiber out, I can stop some of the fermentation in the gut and therefore control some of your symptoms. You're going to feel temporary relief. Whether antibiotics or a low FODMAP diet, you're going to experience temporary relief. And in about 3 to 6 months, you're going to have all of those symptoms back again, and around and around and around we go. Because guess what? Everything that you were handed was just to decrease fermentation. It was either just an antibiotic or it was a low FODMAP diet. But research consistently shows that there is an over 50% relapse rate within the first 90 days following SIBO treatment. And that is because it's not because the person is failing. It's because our entire understanding and the entire model of us understanding SIBO is failing across the board. Antibiotics are going to reduce the overall microbial load. Yes, they're going to take the good guys with it too. So they'll take good guys, they'll take bad guys, but they're not restoring why SIBO is there in the first place. This is a motility issue. This is a stomach acid issue. This is a bile flow issue. This is a migrating motor complex issue. This is a nutrient insufficiency issue. The terrain isn't changing. All you're doing is just killing off some bad guys until those bad guys repopulate right back, because nothing changed about that picture. Same thing with a low FODMAP diet. I can take the fiber out of your diet. I can take away that fermentation fuel for the bacteria, and all of a sudden you might have fewer symptoms, but your digestion hasn't improved, your absorption hasn't improved. So once you try to reincorporate any form of fiber, you're going to have all of those issues all over again. And we know that a healthy diet is a high quality, high fiber diet. So this is not a long-term strategy, okay? So when we think about this more from a holistic medicine perspective, and what the lowdown methods are really teaching and looking at is asking that bigger question of why. If I have somebody that comes in and they're presenting with all the signs and symptoms of SIBO, maybe they've been diagnosed with IBS because of some of those symptoms, I know there's a bigger reason why. I know there's a reason why the bacteria has probably translocated there to begin with. And of course, I'm going to give them that relief of helping them treat the SIBO picture, but that's not where our treatment stops. That's honestly not even where our treatment starts. It has to start with asking the question and really doing that investigation of why. Why are they struggling with this translocation of bacteria picture? I find that it comes down to really 4 main sources. So if you are suspicious of SIBO, you've been diagnosed with IBS, may or may not have been tested for SIBO, and your practitioners are not helping you with one or all 4 of the next following things, then you really got a Band-Aid solution for SIBO, okay? So number 1, we absolutely have to be looking at what is governing what is called the migrating motor complex. And the migrating motor complex is a fancy design in the gut that controls how food and digestive debris move through the gut. It is controlled by your nervous system, okay? So that fight or flight versus your rest and digest state, it's that body sweeping, like scrubbing bubbles coming in between your meals to clean out digestive debris. If you have a deficient migrating motor complex or you have deficits in your migrating motor complex, you're not getting that street sweeper in between meals. And that means that you have a high amount of debris and a high amount of bacteria that is being left behind. Usually this is related to nervous system dysfunction, adrenal axis dysfunction. Sometimes this is also because of stress, eating, grazing, too many snacking patterns that's creating a dysfunctional migrating motor complex. So absolutely we have to be thinking about that in a SIBO picture. Number 2, the SIBO got there for a reason, and it's probably because our body's own antibacterial mechanisms are sluggish. So usually I see high reoccurrence rate of SIBO in conjunction with low stomach acid or poor bile flow. These 2 digestive juices in the body are your antimicrobial gatekeepers. They sterilize the system, they break down the incoming food. If your stomach acid is low or your bile is stagnant because of poor liver function, you're going to have microbial overgrowth and undigested food, and you're going to have a high incidence of SIBO relapse. So I could put you on all the antibiotics in the world, but those antibiotics aren't going to do anything if we don't restore bile flow, which is why the SIBO got there in the first place. So number 1, migrating motor complex. Number 2, we got to talk about stomach acid and bile. Number 3, we have to look at the overall immune system terrain and just the overall inflammatory picture as a whole. The gut, the immune system being so closely in proximity to the small intestine is really where we're going to monitor the microbes in the first place. When your inflammation is high or your nutrient status drops, that microbial, that the ability to regulate the good guys versus the bad guys in the gut is going to be very difficult for your immune system, and it overwhelms your immune system. And then the immune system kind of shuts down. So that should be a really big job of your immune system, is to regulate the good guys and the bad guys in there. And if they don't have enough resources to do that, then we're going to get a high incidence of relapsing SIBO. So immune system function is going to be a really big one. And then the 4th factor is, like I said, a little bit more of a blanket statement, but it falls under everything that could be structural abnormalities. So some individuals with a high incidence of SIBO, a high incidence of IBS, are individuals that have structural issues. Maybe they've had an abdominal surgery and there is scar tissue forming around the GI tract. Maybe they've had an abdominal injury. They might have endometriosis, and the endometriosis is contributing to scar tissue adhesions that are affecting GI motility. Some people have post-infectious damage, so they've had a history of foodborne illnesses before. It's called post-infectious IBS, and that is inhibiting their immune system from being able to mount an appropriate response here. Some people have significant neuropathy that is causing slow GI movement through the gut. So this has to be a total body thought process here. Yes, there are some very real reasons why the gut is having a problem clearing SIBO to begin with and having a high relapse of SIBO. A lot of times, like I said, conventional and functional medicine, in my experience, they're not thinking about these things. All they care about is coming in and like, kill. I'm just going to come in and kill the bad guys. It's like, well, that's cute. That's like only 25% of the overall treatment of this individual. You're just going to leave that person with a more vulnerable terrain than they came in with and a very high relapse rate. And you're not really helping them be able to put that IBS pattern into full remission. We have to be thinking about that differently. And that's exactly what I do in my clinic and my practice with my holistic medicine method. So if you are someone that you know you've had SIBO in the past and are struggling to clear it, it's built up into certain autoimmune patterns for you. You've been diagnosed with IBS, but you haven't been tested for SIBO, and you're curious if these are things that you might be dealing with as well too, head to the link in my bio. From there, you can book us a one-on-one consultation where we will draw some comprehensive labs to really start to understand this picture better for you and get you a more comprehensive plan than just repeat antibiotics or a low FODMAP diet forever, because trust, that is not how we treat SIBO, and that is not really doing anything for your overall chronic IBS picture. And make sure you send this to any friends or family that you feel like are also our gut health warriors out there and could use a little bit of extra support. Hopefully this was helpful, and we will see you guys next week for another episode.